Hello, my name is Leanne Cooper, and I'm the founder and executive director of King's Ranch. We are an adoption support ministry that's committed to equipping families and restoring childhoods. For the past 15 years, King's Ranch has served hundreds of children who have experienced early childhood trauma. We've gained firsthand a foundational understanding of the way attachment affects children and exactly what loving adoptive parents, foster parents, and support systems can do to help. It is our hope that when you understand attachment, you'll gain a greater understanding of the struggles adoptive families face, a greater empathy for challenging children, and a proven effective basis for how to help children heal. In this video, I'm going to teach you the very basics of attachment. We'll discuss what attachment is, why it is important, and some causes and symptoms of compromised attachment. I pray it helps you go from feeling confused to being knowledgeable, compassionate, and ready to begin helping a child heal. First, what is attachment? Attachment, it's that all-important heart-to-heart connection between a mother and her infant. It occurs when a mother is attuned to the needs of her baby and consistently meets those over time. Attachment is formed in the first 3 years of life and is the basis for trust formation. All future relationships are dependent upon the quality of the attachment between a baby and their mother. So clearly, attachment is extremely important. And there's a lot of talk about attachment in the adoption and fostering world. Why? Because research has shown that up to 80% of high-risk families, those are families where there's abuse and neglect, where there's poverty, substance abuse, domestic violence, a history of maltreatment in the parent's childhood, and psychological disorders in parents. 80% of those high-risk families create severe attachment disorders in their children. Statistics indicate that over 800,000 children with severe attachment disorder are coming to the attention of the child welfare system each year. And this does not include the thousands of children with attachment disorder adopted from other countries. There was a study done called Hardwired to Connect, the new scientific case for authoritative communities, and it was done by a commission of 33 pediatricians, psychiatrists, and mental health professionals from some of the leading universities in our nation. And that commission found that there is a crisis occurring in the deteriorating mental and behavioral health of U.S. children. The commission found that as a society, we're using medications and psychotherapies and special programs for at-risk children. And while these approaches are necessary, they aren't enough. We found this to be true at King's Ranch as well. Most of the children who come here have been through all the therapy and are heavily medicated. But we have been able to wean 99% of them off of all medications. The commission found that in large measure, what's causing this crisis of American childhood is a lack of connectedness. And they meant two kinds of connectedness: close connections to other people and deep connections to moral and spiritual meaning. The commission found that connectedness is at the root of many other mental illnesses, and we found this to be true at King's Ranch as well. When we dealt with the root issue of attachment, many of the other diagnoses were removed. The commission found that meeting children's needs for enduring connections and for moral and spiritual meaning is the best way to ensure their healthy development. Their research showed that the best way to meet this need was through what they called authoritative communities. The authoritative community characteristics that they identified described a family and a church. We are the answer to the mental and behavioral crisis in American childhood, families and churches, so we have work to do. You heard me say earlier that attachment is the heart-to-heart connection between the two people, beginning with the mother and the infant. And that attachment is formed in the first 3 years of life. So if that's true, let's talk about what happens those first years of life. Let's talk about that first year of life cycle. When a baby has a need, that baby cries, and that baby will eventually get into a rage. But a good mother who's attuned to the needs of her baby comes and meets those needs and provides relief for that baby. And a little while later, that baby will have another need, and that baby will cry, and the good mother comes and meets that need and provides relief for that baby. And that happens over and over and over again the first year of life, and trust begins to form. That baby learns, when I have a need, my mom comes and she meets that need. I can trust her. And the world is a good and safe place. And that baby forms what's called a positive working model. There's some necessary input that needs to happen that first year of life. That necessary input is essential for proper brain development. Eye contact is extremely important for a baby's brain development that first year of life. Healthy touch and labyrinthine stimulation, which is the rocking and the swaying and the bouncing that mothers just instinctively do for their babies, at all aids in the brain development for that child. Lactose, which is the milk sugar when the mother nurses the baby or feeds the baby a bottle, it's all part of that attachment environment of that first year of life. And then smiles. Instinctively, a mom smiles at her baby, and not too long after that baby's born, that baby will smile right back at their mother. It's all part of the necessary input for proper brain development. Well, what happens for a baby who's neglected that first year of life? That baby has a need, and that baby cries, and nobody comes. And that baby gets into a rage, and the baby shakes, and the baby turns red, and the baby screams. It thinks it's going to die. But nobody comes, or they don't come often enough, and relief doesn't come often enough. Do you think that trust forms the way it should? No, it doesn't. And that baby learns that their mother cannot be trusted. And the world is a very cold and unsafe place, and they form what we call a negative working model. They don't get the necessary input like they should, and it compromises their brain development. Well, what about the second year of life cycle? For a healthy child, that child has a want, and that parent gives an appropriate no. And what does that 2-year-old do? That 2-year-old throws a fit. But the good parent stands their ground. No. A little while later, that toddler has a want, and the parent has to give an appropriate no. And what happens? The child throws a fit. But the good parent stands their ground. No. And that happens over and over and over again, that second and third year of life. And eventually, that toddler has a want, the parent gives an appropriate no, and that child accepts the no. So that child has learned to accept boundaries. They have learned to respect authority. Let's think about the baby who is neglected. That baby's grown up to be a toddler. And that baby doesn't have anyone around to give an appropriate no, or the parent doesn't care enough or is in their own addiction. So the child is roaming around, fending for themselves. There's no one around to give an appropriate no for that child to learn to accept a boundary. So that child doesn't learn to accept boundaries and doesn't learn to respect authority. And that leads to all kinds of problems for that child in the future. So what happens if these cycles aren't completed correctly? The child will have difficulty forming future relationships. They'll have a lack of genuine affection. They do not learn to trust. They do not develop a full conscience. They do not respect authority, and it leads to overall behavioral problems for that child. What are some possible factors leading to compromised attachment? The first one is maternal ambivalence toward the pregnancy. Maybe the mom didn't really want the baby. Maybe she really wanted an abortion. Babies know, they can sense the rejection, as evidenced in the book, The Secret Life of the Unborn Child. Those first 9 months matter. Babies know, they can sense rejection. In utero trauma, drugs and alcohol exposure can cause problems with attachment. Physical, emotional, and sexual abuse. Neglect, which is far worse than abuse, because at least with abuse, a child is getting some stimulation. With neglect, they have no stimulation for their brain. Sudden separation from mom, maybe she abandoned the baby. Maybe the baby was adopted or put into foster care. As happy and wonderful as adoption is for adoptive parents, it's still a separation for that baby, and it's traumatic for them. Chronic maternal distress. Maybe the mom is a victim of domestic violence, or she's living in a chronic traumatic environment. Several moves and placements, as in a child who's in foster care or has multiple failed adoptions. Every time a child is moved, their attachment problems get worse. Unprepared mothers with poor parenting skills. Maybe the mother is really young. Maybe she has her own attachment struggles. Maybe she has no support. Premature birth. We even see babies who've spent extensive time in isolettes who weren't able to be touched as much, or the touch was painful touch. Sometimes those babies can have compromised attachment. Let's talk about what happens in the brain, the physiologic component of compromised attachment. It's amazing with the new brain scan research. This is a PET scan of a healthy brain on the left. It's a normal child, and you can see the regions where it's red is where it has the high electrical activity, and the places where it's black and blue is the low electrical activity. And at birth, the only primitive structures that are fully formed are the brain stem. They're the only things that are fully functional. The temporal lobes and other areas of the brain are wired by early childhood experiences. And look over here at the brain scan on the right side. It's a PET scan of an abused brain, a Romanian orphan who was institutionalized shortly after birth, and you can see the effects of extreme deprivation in infancy. You can see here the temporal lobes, which regulate the emotions and receive input from the senses. They are nearly non-functioning, and a child like this will suffer from emotional and cognitive problems. If you look back over here at the healthy brain, you'll see where is the most electrical activity. It's up here in the front, that frontal cortex, which we like to call the love and logic part of the brain. This normal child lives mostly in that frontal cortex part of their brain. But if you look at the abused brain, you will see most of the electrical activity in that back part of the brain, the fight, flight, or freeze part of the brain. So that child's default is going to be fight, flight, or freeze. The good news is the child on the right, the abused brain, their brain can start to look a whole lot more like that healthy brain on the left. And that's what we're doing with Unplowed Ground therapeutic parenting. We're rewiring the brain. There's a continuum of attachment, and we are all on it. The children who are in your home are on it as well. Maybe your mom often was attuned to your needs and attentive to you and met your needs. And if that was the case for you, then you have what we call a secure attachment. But maybe your mom sometimes met your needs and was attentive to you, and sometimes she wasn't. Sometimes she was distracted with her own trauma or her own addiction. You may have what we call an insecure, ambivalent attachment. Or maybe your mom rarely was attuned to your needs and rarely met them. If that was the case for you, then you would have what we call an avoidant attachment. And the saddest of all, maybe your mom wasn't attuned to your needs at all and she didn't meet your needs, but she also was a source of terror for you. If that was the case for you, you would have what we call a disorganized attachment. And our prisons are filled with people with little to no attachment. They do not trust, and they have no conscience development. So keep that in mind when we talk about the symptoms of attachment. That can be a clue as to what type of attachment style your child has. The good news is that with work, your child can move closer to a secure attachment, and so can you. So what are some symptoms of compromised attachment? Superficially charming. A child can be very charming to people they don't know very well, but they take the mask off when they get home, and their behavior is much different, especially towards their mother. Next, a lack of eye contact. They didn't get the attachment environment where their mom was looking into their eyes when they were a baby, so eye contact is very difficult for them. It's very vulnerable to look into someone's eyes, and it will be difficult for a child with compromised attachment unless there's an ulterior motive, and then they can make really good eye contact. Indiscriminately affectionate with strangers. They'll call anyone mom or dad. They will go to anyone. They do not have appropriate stranger danger. They are not affectionate on parents' terms. Your hugs may be greeted with stiffness or arching of the back or screaming, "Ow, you're hurting me." They can be destructive to themselves, pulling out their hair or hitting themselves. They can be destructive to others, hitting, kicking, and spitting. They can be destructive toward material things, tearing any and everything up, damaging furniture and walls. They can be excessively controlling or hurt animals or small children. They can lie about the obvious. They will stick to their lie no matter if the evidence is clear right in front of them. Stealing. Many children with compromised attachment are master thieves. It's sometimes hard to catch, but I will give you strategies to deal with it. No impulse control. Frequently they act hyperactive, and most children will be diagnosed with ADHD. A lack of conscience. They do not trust, which causes their conscience development to be stunted. But once trust begins to build, their conscience will increase. Abnormal eating patterns. Sometimes they hoard food in their rooms, under their bed, between their mattresses. They'll eat until they throw up, or they may not eat anything. They may like a particular food one day and hate it the next day. Poor peer relationships. Remember, all future relationships for your child will be affected by that primary relationship between mother and child. Until that is fixed, they will have poor peer relationships. Preoccupation with fire, blood, and gore. Remember, they formed that negative working model the first year of life. They tend to be drawn to the negative and the dark side. Preoccupation with bodily functions. Some children with compromised attachment will urinate down the air vents, urinate on the walls, or smear feces on them. We had a little girl who smeared feces on herself to push her parents' love away. Persistent nonsense questions and chatter. They are always talking. They can't seem to have times of quiet. They're thinking up anything to say to make noise. Non-stop demanding of attention. It doesn't matter if it's positive or negative. They just must have the attention. Triangulation of adults. This is a big one. They play mom and dad against each other, the therapist and the parents, the teacher and the parents. They try to divide and conquer. false allegations of abuse. Sometimes children will falsely accuse of abuse. If your child does this, document everything and have your therapist document as well. Creating chaos. They create chaos wherever they are. They feel chaotic on the inside, so they create it on the outside to match. This is what leads to confusing chaos in your home. It's important to note that a child with compromised attachment may show some, but not all of these symptoms, depending on how severe their attachment struggles are. So we've talked about what attachment is, why it's important, and causes and symptoms of compromised attachment. You may be feeling overwhelmed, especially if you recognize many of these symptoms in your child. There is help and hope. We can teach you techniques that will plow their heart soil and rewire their brains. That's what Unplowed Ground is all about. Cultivating the soil of your child's heart so that they can accept your love and one day the love of their Heavenly Father. Whether you're an adoptive parent, a pastor, a teacher, or part of a support system for a vulnerable child, we want to say thank you. Thank you for taking the time to learn about attachment. I hope this has given you a greater understanding of the struggles that adoptive families can face, a greater empathy for challenging children, and a basis for how to help a child heal. Thank you for answering God's call to care for the orphan by supporting the family called to adopt. We're honored to serve alongside you.